Thanks very much for joining us. The UMass Chan Medical Center in Worcester is one of the most important institutions in our state. It's at the leading edge of our stature as an international leader in medical education, research, and innovation. The school's leader, Dr. Michael F. Collins, will step down next year after nearly 20 years as chancellor. And while he's helped guide the school to great heights, it looks like his departure will coincide with a very troubling period in its history as it faces major federal cutbacks. In any case, Doctor, thanks for making the drive in. It's good to see you.
Nice to be with you.
So you're facing really unprecedented federal cuts. I know a lot of this is tied up in the courts, and some of that may be mitigated. But what has the impact been on what you do at the Chan Medical School?
Well, it's really been challenging in many ways. I would say principally we're managing in a time of great uncertainty. In the past we could rely on federal support for research, and now great uncertainty has been raised as to whether or not that will continue. We have been able to rely on a meritocracy where if we were to recruit and retain the best scientists, which we believe we have done at UMass Chan, that they would win their share of grants, the grants would be funded, and research that could change the course of history of disease would occur each and every day. And that's now been brought into great question.
Well, let's make it clear what kind of research we're talking about. Pediatric cancer research. I know you can't run through the entire litany, but, this is serious medical research.
It is
Nobel Prize winning medical research.
In fact, we are the Nobel, one of our faculty members won the Nobel Prize this year. There'll be a new one selected shortly, but Victor Ambros, and that was our second Nobel Prize. And their science, both Dr. Mello and Dr. Ambros did science on, RNA biology. We have one of the world's largest RNA therapeutic institutes. So it is, John, it's everything from pediatric brain cancer. We have a great focus on neurodegenerative diseases like ALS, all the cancers that you could name, and much of this now is uncertain.
What's your understanding of why the government wants to cut funding for this kind of research?
Well, I think it starts with sort of new priorities and new ideas. If you take the government and what they say, that we're just establishing new priorities. Honestly, I don't understand this because just about every family in America is affected by cancer. And research brings hope to the human condition. And without research, I don't know, if you don't have hope, I wouldn't know how you get out of bed in the morning. Just think about it for a minute. If you have no hope. And here we have hundreds of millions of dollars of research being done on our campus. We contribute almost $2 billion to the economy of Massachusetts. We are working to try to find, novel ways to treat patients and to cure, some of the most complicated diseases that exist. We have a focus on rare diseases, 7,000 rare diseases in the world, and we think by changing one gene that these diseases could be cured. But unless we do the research, we'll never get to the point to be able to cure.
Well, the research, we have to take a break here, but the research will probably be done in other countries if it isn't done at places like the Chan Medical School.
Unfortunately, we see many of our faculty being talked to by institutions across the globe.
I want to talk to you more about what that bodes for the Massachusetts economy in general and for the future of the institution. And we'll do that when we continue our conversation with Dr. Michael Collins, Chancellor of the UMass Chan Medical School. So please stay with us. Welcome back to our conversation with the Chancellor of the UMass Chan Medical School in Worcester, Dr. Michael Collins. And Doctor, you mentioned the groundbreaking RNA research that has been done at the medical school over the years. This, of course, was the precursor to the mRNA, the vaccines, and so forth. Vaccines these days are highly controversial. First of all, what do you make of that? And how much damage was done to the medical profession, to the work you do, by the pandemic?
You know, shocks me to this day, John, that one of the outcomes of the pandemic was people started to question science. I don't think there's a problem with vaccines. Vaccines have cured millions and millions of people have prevented millions of people from getting disease. And I think that it's so important for patients to talk with their physicians, to understand, to enter a dialogue about their kinds of care, because without vaccines, you know, we would have measles and chickenpox and things that we know can kill people, right? And you know, I had my flu and my COVID vaccine last week. Mm-hmm. And, you know, I feel quite confident that this was a good thing to do because, you know, honestly, running a big thing like I do, I don't want to be sick when I don't need to be sick.
Well, now America's leading vaccine skeptic is the head of the federal agency overseeing health, Robert F. Kennedy Jr. What do you make of that?
Well, I don't really want to criticize government. What I want to say is that the medical profession, the research enterprises across the nation are working each and every day to make the health of Americans better, to make an impact globally. If you look at the science that's been done in our country, just about every medicine that a patient can buy started with research done that was funded by the NIH. And many of the vaccines that have been developed in our country now prevent diseases across the globe. And what I would recommend is that people who are qualified, namely patients, doctors, people who are qualified should be the ones who are giving advice to people, to patients about whether or not they should be taking vaccines, which they should be taking, and when they should be taking them.
You've had to do layoffs at the Chan Medical School. You might have to do more if this funding doesn't materialize. In the meantime, there's a gap. Governor Healy has proposed spending $400 million being repurposed from other tranches of money in state government to help you and other medical institutions through this difficult period and kind of minimize the bleeding, if you'll pardon the expression. But it's not moving very quickly through Beacon Hill. A lot of people from Beacon Hill watch this program. What's your message to them?
I think we're fortunate to have a governor that gets it. I think we're fortunate to have a governor that understands the impact of eds and meds in the Commonwealth. I think we're fortunate to have a legislature that supports the universities and the hospitals in the Commonwealth. You saw our bill just this past week, you know, worked on quite effectively and quickly to help hospitals in the Commonwealth. A similar thing needs to be done now for the research enterprise. In order for us to bridge some of the challenges that we face at the moment and not lose a generation of scientists, not lose people to other countries because we know they're being recruited to other countries, and not giving the wrong message to young people who see a career in science as a way to blossom and to fulfill a lifelong goal, it's going to be critical for us to get the money, and the money needs to be now, because the longer we wait, the more difficult it will be to prevent the loss of a generation of science.
I mean, we're out of time, but just to underscore the point, this isn't just the future of our health we're talking about here. This is
future economy of Massachusetts.
Yeah, exactly.
Certainly.
Wow, it's at risk. And thank you for what you're doing. Appreciate you coming by.
Nice to be with you.
Dr. Michael Collins of the UMass Chan Medical School. That's all our time. Right now, I'm going to send it back to my colleagues for more WBZ News.